Coding is a conventional term that refers to, let's say, a process that will lead a patient suffering from alcoholism, to a stable and long-lasting remission for a certain period of time, and they will not consume alcohol at all, in principle. In other words, it's like a block that is placed between the patient and alcohol. That is, after the coding process, the patient, let's say, is no longer able to perceive alcohol as, so to speak, a means of satisfaction or as a biological agent. There are different types of coding, ranging from hypnosis to the placebo effect, the effect of intimidation, and so on. There are various methods of coding, but the question is how effective it is and to what extent it justifies itself as a treatment process. In our clinic, we use a strictly medication-based coding, because when a certain type of drug is administered into the body, we can be 100% sure that it works, that it is effective. Because if we take hypnosis as a parallel, we cannot say that it works the same way for everyone. It may work for some people, but for others it may not work at all. And after that, a person might go to a kiosk the next day, buy alcohol and drink it. In other words, it will be ineffective. With medical coding, which is used in our clinic, the result is 100%. That is, we clearly understand that we have administered the medication, it is in the body and it is working. That's it. No other changes are possible. The process of coding, or let's say the introduction of an alcohol blockade, as we call it scientifically, coding is still more of a common term. It means the introduction of a medication patented in our clinic into the body, which blocks the action of the enzyme alcohol dehydrogenase. The enzyme alcohol dehydrogenase is specifically responsible for the breakdown of alcohol into its final products. First, alcohol is broken down into acetaldehydes and then into acetic acid. This enzyme, alcohol dehydrogenase, is exactly what is responsible for that process. The medication we use for this purpose blocks this enzyme, and as a result, no breakdown of alcohol occurs. Alcohol simply enters the body and is not metabolized. We know that anything that is not metabolized in the human body becomes a poisonous or toxic substance for the body. So if this blockade has been administered to a person and they somehow manage to consume even a small amount of alcohol, even at low blood alcohol levels, it results in severe intoxication, nausea, vomiting, dizziness, a drop in blood pressure, and changes in pulse may intensify. All of this occurs against the background of the blocked enzyme alcohol dehydrogenase, and in the case of alcohol consumption, naturally, knowing that alcohol brings them no benefit, a person psychologically distances themselves from it. This gives us the opportunity to achieve stable remission in patients for at least a year or more. We achieve remission for up to 15 years. That is, a person does not consume alcohol at all for 15 years. This is the principle behind our method, our blockade, or let's say our coding. In other words, we always support the medical administration of medications, medical coding, because we clearly understand and are fully aware that as long as this medication is in the body, the person will not consume alcohol under any circumstances. We have developed a system for introducing the alcohol blockade into the body using various methods. To be more precise, there are two options for administering the alcohol blockade. Either in injectable form, that is, the alcohol blockade is a two-component medication, one in crystalline form and the other in oil-based form. One component is injected into the subcutaneous fat of the abdomen, and the other component is injected into the gluteal area. This is a specific injectable form of administering this medical alcohol blockade. In addition to the injectable form, there is also a method of implanting this medication into the subcutaneous fat of the abdomen or the gluteal area. Essentially, these methods do not differ from each other in their nature or how they work. They were developed, so to speak, for aesthetic reasons and for user convenience. For example, if a patient comes to us who is able to return for additional extended injections, then we use the injectable form of administering this medication. If, however, the patient is someone whose profession often keeps them away, such as seafarers, sailors, people who frequently travel abroad or are often on the road and do not have the physical opportunity to come in for repeat injections. We offer them the method of implanting this type of blocker. This allows us to administer a higher percentage and a larger amount of the medication through an incision in the subcutaneous fat of the abdomen or in the buttock area.